Financial assistance is available to people with Medicare. Medicaid is a federal, state health insurance program that is available for people with low income and resources and covers most healthcare costs if you have both Medicare and Medicaid. Eligibility is determined by your state. DMAP is available to help individuals apply for the Medicare Savings Program. These programs help individuals pay for their Medicare premiums, deductibles, and co-insurances. We'll talk about three programs today: the Qualified Medicare Beneficiary Program, QMB, Specified Low-Income Medicare Beneficiary Program, and the Qualifying Individual 1 program. These amounts are determined by the state of Delaware. To qualify for the QMB program, which covers your Medicare Part A and B premiums, deductibles, and co-insurance, it is based on an individual having an income of less than $1,063 per month, or a married couple having an income of less than $1,437 per month. There is a program available through the SLMB and the QI1 program. And to qualify for those programs, your income must be less than $1,435 for an individual and less than $1,940 for a couple. Assets and resources are not counted against you. So you could have $1 million in the bank and your Social Security check be $1,200 a month, and you qualify for Medicaid. So I would encourage you to contact our office to see if you qualify, and if you don't qualify, then maybe a loved one or a friend is eligible for the program so that you can share that information with them. There is also Extra Help that is available, and Extra Help is a program to help people pay for their Medicare Part D premiums, their deductibles, and their co-insurance. Again, it's for individuals that have the lowest income and resources. They will pay no premiums, and there will be a small or no co-payments. For someone who has a slightly higher income and resource, then they'll pay a reduced deductible and a little bit more out of pocket for their medications. If someone qualifies for Extra Help, there is no coverage gap for the Part D, so they won't reach the donut hole. To qualify for Extra Help, again, the individual would need to contact our office. For a married person, you cannot make more than $2,155 per month, and you cannot have resources that are more than $29,160. For a single person, the income amount is $1,595, and you cannot have resources that are more than $14,610. So you can contact our office. It takes about 10 minutes to complete that application. You again would need to know your social security number. You would need to know your income amount, your resources, if you have stocks, bonds, IRAs, if you have a pension, you have a social security income. All that information is needed to process an Extra Help application. It is actually done on the Social Security website, so if you feel more comfortable with you handling that application, please feel free to go to the Social Security Administration to complete that application. There's also another program that is eligible here in Delaware. It's called the Delaware Prescription Assistance Program. It is from a tobacco settlement, probably from 20 years ago. And the Delaware Prescription Assistance Program, also known as DPAP, will pay your Medicare Part D premium in full. It will pay 75% of your Part D deductible, and you will pay $5 or 25% for the cost of your medication. To qualify for that program, you must first complete an application for Extra Help. The state of Delaware needs to know that you've been turned down from the federal government. So you would first complete an Extra Help application, and then you would apply for the Delaware prescription. Now, the income limit for the DPAP program is $2,126, and that's based on an individual. So if you are a married couple, then it is possible that only one person will be qualified for that, because they do look at you on an individual basis and not as a married couple. And that benefit for the Delaware Prescription Assistance Program is $3,000 annually. So that again gives you $3,000 to use towards the cost of your Medicare Part D costs. So if you know someone, or if you qualify for any of the programs that we just discussed, please feel free to gather all your financial information, contact DMAB, and we will be more than glad to provide you with application assistance.